Dr. Megan here. We are with Stephanie, who is 34 weeks pregnant, and I'm just gonna walk you guys through how we would adjust her. All right, so first we're gonna check her sacrum by bending her knees. We're looking for an extra tension on one side, so that right leg isn't going in as far, which tells me that her sacrum, that triangular bone, is rocked this way. Big breath in, all the way out. Good job. We'll just let her settle into that adjustment, and then we'll recheck, and hopefully you can see that both of those legs go closer together. All right, next we always check a muscle called piriformis. That's in the hip region. That is what the sciatic nerve runs through. So when that gets really tight, which it does during pregnancy, because when our abs turn off, they start to separate and start working less to protect our low back and more to get prepped for birth, to push baby out. It has a reaction to other muscles in our body where other things turn off, but things like hip flexors and piriformis turn on overdrive. So we're just gonna give some soft sweeps to help those calm down a little bit. All right, when you're ready, come up on all fours. I'll take the pillow. Okay, and you can make your way to your back. Okay. Now we're gonna check pubic bone. If this was her first adjustment, I'd ask her to find it for me. Feels pretty even. So I'm actually gonna leave that alone. And that's gonna help us check for if she has tightness on one side of her hip flexors or not. And you can see that her left hand is a little bit shorter. So as long as there's no shoulder issues going on, then this is the side of our tight hip flexor. You can bring your hands down. All right, we're gonna bend this knee. And we're just gonna slide into that hip flexor. And as she takes some big breaths, I'm gonna give it some range of motion in the hip and lightly massage, keeping everything symmetrical and open. Again, so baby has all the room it needs. So just slight pressure in here, and then you're just gonna let this knee go so I can have full range. Big breaths. Good job. That, you know how to breathe. You're gonna be ready. Bring those arms up overhead, a little bit more even. Last thing we're gonna do is check the round ligament that actually acts a little bit more like a muscle. So we treat it kind of like a muscle trigger point, and we're gonna find it. It's kind of halfway between the belly button and the pubic bone. And Stephanie's really good at breathing. You can see how her belly moves. Sometimes we'll give it a couple circles. All right, my dear. You are all set.
Okay, thank you.
Thank you.